everybody, my name is Dr. Tobin Forbus, and I'm here this morning with Dr. Ryan Rieser from Shenandoah Valley Orthopedics and Sports Medicine, formerly known as Orthopedic Associates. Many of you know the doctors from Orthopedic Associates, Dr. Peerless, Dr. Esteban, Dr. Otney, Dr. Dean, Frank Fisher, and Bob Lyonez. They're one of the greatest orthopedic practices in the area, as I'm sure most of you know. We're very fortunate to have them in our area. And we're also very fortunate now to have Dr. Ryan Rieser join the team at Orthopedic Associates, now Shenandoah Valley Orthopedic and Sports Medicine. So today I just want to introduce you to Dr. Ryan Rieser and get to know him a little bit. So Dr. Rieser, first let's just start with, where'd you grow up? Where are you from?
Yeah, I was born in Charleston, South Carolina, but raised in Winston-Salem, North Carolina, just outside of there. Which was a fantastic place to grow up, but I very frequently came up towards Virginia to go backpacking. Nice. Yeah, so I love the mountains up here. I mean, good mountains, North Carolina too, but a little better in Virginia, I'd have to say.
Awesome, awesome. And so where'd you end up going to college, and how was your experience in college?
Yeah, so I went to North Carolina State University for college. I did biomedical engineering there, which was fantastic. And you go through grade school, you always feel, they always force you to learn subjects you're not really interested in, so it was wonderful in college to be able to hone in what I really enjoyed, and engineering was fantastic. One thing I found that I didn't like was sitting in a lab just doing engineering all the time. I like talking with people. That was a big thing for me, was having a connection for people, which is kind of what drove me to go to medical school in order to, with the goal of going into orthopedics.
Nice. So tying it all together, the engineering and the patient care side, human interaction. That's awesome. And so where'd you end up doing your medical study?
I went to Wake Forest, University of Winston-Salem, actually right where I grew up, which was pretty neat, but the school was fantastic.
Awesome, awesome. And so a lot of physical therapists, we go into physical therapy because we've had injuries in the past. We've injured our knees, we've injured our shoulders. Psychologists, we're not going to say why they go into that field. But so was there any particular experience that led you down the path of becoming an orthopedic surgeon?
Yeah, there wasn't any particular one experience. It had more to do with the things that I found interesting in life. And my dad he's an interventional radiologist, and I used to go into work with him quite frequently, kind of sit behind the LED screen and watch all the things he would do. And I was just fascinated with the tools. And I guess that's one thing that kind of led me towards doing biomedical engineering, because I enjoyed, all the technology that goes along with it. But then it was mainly in college just finding out that I really enjoyed the personal connection, and I did some medical missions trips, which really helped solidify that when I was in college.
Awesome, awesome. Where'd you go?
The main place I spent close to 12 weeks in Belize at Hopkins Village.
That's awesome.
Yeah.
That's going to be a life-changing experience for sure.
It absolutely was.
Awesome. So how'd you end up in the Shenandoah Valley? What led you here?
Yeah, so I was looking at different groups, kind of Virginia through South Carolina, so I want to be fairly close to my family in North Carolina. My wife's family's in North Carolina. And the main thing was the group here. The four guys are four fantastic guys that care about their patients. It's not just about running some fast-paced clinic, but they really do seem to care about their patients and the community. So it felt kind of right at home with the guys when I met all of them. Plus the Shenandoah Valley is a beautiful area and a great place to raise families, so it all kind of seemed to fit for me.
Awesome. Yeah, I have to agree that after 19 years of being a PT and working in Philadelphia and the Poconos and Harrisonburg, they're the most approachable group of orthopedic surgeons I've ever worked with. They're just really nice guys, and I think that's awesome that you found them and that you guys meshed so well. So
yeah,
that's great. So what would you say motivates you to do what you do? What would be your goals that you want to accomplish as a surgeon in this area?
Yeah, I mean, the biggest motivation is really getting people, back on their feet, or maybe back on their hands. But, and it's just, obviously I enjoyed the engineering aspect of it, and I get to kind of stimulate my brain and take care of folks at the same time, and that's my biggest motivation. I mean, my goals for the community, is really concentrating on total joints and really having a nice joints program here. And the nice thing about this group is they've already done, fantastic work at developing a good joints center here from before surgery and after surgery. But there's some things that I've learned in training that I'd like to bring and hopefully stay on top of the literature and keep developing the program as we learn more information.
Nice. That's a good segue, but your concentration within the practice will be more joint replacement?
Yeah. So that's the majority of my training was on efficient and kind of very well done primary joints in the first joints, and then also the revision joint placement. So when the parts are worn out and all that kind of stuff to go in there and get the best construct we can.
Awesome. That gets a little more complicated, right?
It sure does.
Clean it up. So do you have any people who've influenced your life over the years, key mentors or people who've affected you in your path to become a surgeon?
Yeah, I think I mentioned it already. So mainly, I would say my dad, having the medical background that he had already. Plus, he had a tremendous work ethic. I mean, there were long part of his life, he's working 70 to 80 hours a week, taking care of his patients. And it's just the kind of job that he had. But, I had a lot of respect for him for doing that. So I say a lot of my work ethic, probably came from my father and also the aptitude for education.
Nice. I imagine you got to see some pretty cool stuff with his overseeing his interventional radiology.
Yeah, it was really fascinating. I had thought about doing radiology, but the one thing that steered me away from it was sitting in the dark room all day, every day, going through my training. I didn't think I could handle that.
Wearing the lead suit. So we talked about your concentration on hip replacements. What do you feel about physical therapy and its importance with your post-op patients?
Yeah, I mean, and even my pre-op patients too, I think it has a tremendous role. When we go in through surgery, especially when I use the anterior approach for hips, try to spare the muscles as much as possible, but I mean, without a doubt, we shut them down to some degree when we go in there. Plus, with avoidance from pain, the patients get weak. And when they get weak, their joints, not only the joint we worked on, but all the other joints, can become painful too. So physical therapy is a tremendous part in getting their muscles up and going and also balanced all around their whole system to make sure everything's working in unison again. So it's extremely important.
Awesome. I appreciate that response. I'm obviously a little biased here. Thank you for that. So lastly, I know you're a family man. Any other hobbies or outside activities that you look forward to doing in the Shenandoah Valley?
Yeah, absolutely. I mean, when I was growing up and even in the medical school, I loved backpacking. And I haven't been able to do that very much recently with all the training that I've been doing. So I'm definitely looking forward to doing that again, and now I'm in a wonderful area for doing that, so I should be able to make a few quick trips. Have some very young kids, so it's going to make it a little bit difficult, but thinking about car camping and that kind of stuff.
Yeah, I got to do a little of that with the young kids.
Yeah.
Well, awesome. I really appreciate you coming in today. It was very nice meeting you.
Very nice
and
meeting you too.
We look forward to everybody getting to meet Dr. Ryan Rieser. Again, he's at Shenandoah Valley Orthopedics and Sports Medicine in Fisherville, and thanks for your time.